So with no further ado, Megan Almanza is here. She is the admissions specialist for the National Institute Medical Assistant Advancement known as NIMAA. And we are going to be learning about her career journey that led her to a current admissions role, the being able to review the role and responsibilities of a MA medical assistant, discuss different career paths, and explain the NIMAA program structure. So we are excited. Megan, go ahead, drum roll, and take it away.
Thanks, Rebecca. Hi, everyone. So I'm Megan Almanza. I'll go ahead and get my screen shared here. Let's see. Oh, here we go. Okay, you can see that well, right? Okay, awesome. All right, so again, I'm Megan Almanza. I'm the admissions specialist here at NIMAA. Just a little bit about my career journey. So I did attend a four-year college. I got a bachelor's of science in applied learning and development. I went on to become an elementary teacher. So I was a fourth grade teacher for 6 years. Throughout that time, I really kind of grew into some leadership roles there. I was a mentor teacher, so kind of taking on new teachers and kind of showing them the ropes and things like that. And then really starting to take on a professional development side of things. So I would go to conferences or professional development sessions and then kind of bring that information back to the teachers on my campus and just kind of tell them about what I learned, how we can implement this into our school, and how it would benefit our students. So I really found a passion for that, and I really liked kind of working with the adult side of education. So that's what kind of led me to pursue other things outside of elementary. So I kind of wanted to just really work with adult learners and kind of help them navigate the post-secondary education world. So what they're going to do after graduating high school, or, even if they've taken a break after graduating high school, how to get back into an educational program. So I found NIMAA, and I'll talk a little bit about NIMAA today and kind of what they do, but I think that NIMAA kind of combined my education background and my passion for education with healthcare. So originally when I started college, I did want to pursue a nursing degree. I wanted to be a nurse. So I took a lot of science classes, kind of midway through college. And I really then kind of changed my mind to go into education. So I do have a lot of knowledge in the medical field, kind of anatomy, physiology, pharmacology, things like that. And so this kind of role just really combines both of those passions, the healthcare field and education. So as an admissions specialist with NIMAA, my role is mainly recruitment focused. So I bring this opportunity to communities. I let them know about our program, kind of the benefits, just about the general structure, medical assisting. So I'm really helping recruit new students. Once they apply, I'm helping guide them through the admissions process. I'm responding to their emails, their text messages, their calls, answering any questions they have about the program, their, just the admissions process itself. So kind of taking on kind of a counselor role as well, just kind of presenting all the options to them and making sure that they're making informed decisions about what's best for them in their next education journey. And then, once they are signed on, I'm kind of helping them gather the documents that they need to get submitted to and fully enroll in the program. And then, they're passed off to their instructors, they're in the program, and I'm starting with the new set of prospective students. Okay, so next I do want to start off with just kind of a little warm up, kind of some healthcare, get us into the healthcare mindset. So this is a question that a medical assistant might see on one of their credentialing exams. So I do have these scattered throughout the presentation. So I'll give you a chance to just kind of think of an answer. We don't have to necessarily shout it out or anything. Don't want to put anyone on the spot, but you can all think of what the answer might be. So the question here is, which of the following would be categorized as a flat bone? A, femur, B, scapula, C, vertebrae, D, metatarsals, or E, mandible? So again, this is a question that a medical assistant would have to study and prepare for, and it might actually see on their exam. Give you a couple more seconds. All right, so the answer is B, the scapula, and that's kind of like your shoulder blade back here. That's a flat bone. Yeah, so I have some of those questions scattered throughout, just so you can see kind of what they are learning in their coursework. Okay, so about NIMAA. NIMAA stands for the National Institute for Medical Assistant Advancement. We are a nonprofit school that trains medical assistants, and we work with a lot of federally qualified health centers. So I know that's kind of a long phrase. If you have not heard of a federally qualified health center, they are also a nonprofit organization funded by the government. They kind of work on a sliding scale fees. So based on a family or a person's income and the size of their family, that kind of helps determine how much they're going to pay for their visit and the services that they need to receive. And then also people are not turned away for not being able to pay or for any of their like insurance qualifications or things like that. They are going to be given the health care that they need. So we do partner with a lot of federally qualified health centers.
Megan,
Yes.
quick question. Is there a place in the medical field for sign language interpretation?
Oh, absolutely. Yeah, definitely. So each clinic, usually has like their own interpretation service. So that role, even if like you were kind of dual-sided, a medical assistant and able to interpret, I could see that being a really good skill set for the clinics to have. But yes, there's definitely a necessary need, and there are positions within the field. Yeah.
Okay, great question, Amanda. Thank you for answering, Megan.
Yeah, absolutely. Okay, so then just kind of a quick agenda of what I'll kind of talk about, the role of a medical assistant, just kind of our program overview, some requirements, the application process, just things like that, and stuff for you to like, action items for you to take away when you're thinking about your next journey. So a medical assistant role is kind of twofold. There are the clinical side of the role, and then there's the administrative skills. So clinical skills, are not limited to, but are rooming the patients. So most often when you go to your primary care physician, the person comes out of the back office, calls your name from the waiting room, and takes you back. They're really that first point of contact that you have besides, checking in at the front desk. That's usually a medical assistant. So their job is learning how to make that first interaction a positive one with the patient, thinking about the patient's background, past experiences that they might had in the clinic, and how might they be feeling? Are they uncomfortable being there? Have they had a bad experience in the past? Is this a new experience for them? So kind of rooming the patient. They're taking their vitals, blood pressure, height, weight, temperature, all the things like that to get them prepped to see the provider. They are skilled in phlebotomy, so drawing blood, and then immunizations as well, so giving vaccines and shots and stuff, along with other clinical skills like that. So then there's the administrative side. So sometimes that person at the front desk greeting you, checking you in is also a medical assistant. They're also trained in calling patients, scheduling, updating the electronic health record system. So that's what you see here, EHR. Billing and coding. So they're working with insurance companies. I would say that medical assistants are really just a bridge between the patient and everyone else on the healthcare team. Again, they're that person that makes that initial connection, and they're really there to help, fill in that communication between, the provider and the medical assistant. Sometimes after the doctor leaves, the medical assistant comes back in and just make sure that you understand what the doctor was saying. You have time to process that, and they're kind of doing that teach back and like little conference with you as well. So very important role. And I encourage you next time you go to your clinic to kind of really pay attention to the medical assistants there. Okay, I have another question for you. All right, so here's another like test question that they might see. If the name of a condition ends with the suffix itis, what does that indicate? Okay, does that mean broken, inflamed, dying, or shrinking? Okay, so if a condition is ending in the word itis, give you a couple seconds there. All right, Amanda, you are correct. It is B, inflamed. So that means, yeah, inflamed. Okay. And then next, just kind of maybe why you might want to go into the uh, medical assistant role. So a lot of primary care organizations are moving from a physician-centered practice to really having teams kind of care for patients. They have the responsibility of a team. So that's the way we've been seeing healthcare go. Instead of just, for example, a doctor really focusing and controlling all areas of the clinic and the patient care, really we're seeing them spread and delegate those tasks, divide those tasks out to their teammates, the medical assistants, the nurses. Other people on that healthcare team might be behavioral health specialist or any kind of other specialist, right? Cardiologists, things like that. They're all a part of the patient care team. So medical assistants do play a vital role in this team. Like I said, they really have that first connection with the patient, and they're kind of communicating what all the other people on the team need to communicate back to the patient. So they're really that liaison, that bridge. And then it's a great way to make a difference in your community. So you are getting directly involved with the patient care of the people within the community, overall just treating them, getting them healthier, and kind of contributing to the increase of health in your community. And then it's a great way to get into the healthcare field. So becoming a medical assistant is just a great way to get started. Many medical assistants have more advanced roles that people can take on with added responsibility and things like that. A lot of people continue on to go after their medical assistant to be a nurse or even a physician. Some people use the medical assistant experience on their resumes into medical school or PT school, physical therapy school. So it's just a really great way to get that patient experience because you're so one-on-one with patients. It's one of the best roles that's, kind of entry level to get you that experience. Okay, any questions so far? Okay. Okay. So just some interesting facts from the Bureau of Labor and Statistics, and this is something you can research as well. Employment of medical assistants is projected to grow 15% from 2023 to 2033. So we're on the rise. There is a need for medical assistants. On average, they're projected to be about 119,800 new medical assistant job openings each year. And then in 2023, medical assistants held almost 784,000 jobs in the US. So as you can see, it's growing. There's, a lot of job availability out there. Okay, next I have another question for you. So if the patient cancels an appointment, it is essential that you, A, check if they need to reschedule, B, bill them if they can, or bill them for the canceled appointment. C, remove their record from the database. Or D, mark their record as closed. So this kind of wraps into those administrative skills that I was talking about. Give you a couple seconds there. Feel free to pop a letter in the chat. Okay, it's A, so check if they need to reschedule, right, is the most important step. Other things might need to occur as well, but check if they need to reschedule that exam. Okay. So next I'll just talk about kind of where medical assistants can even work. I actually looked at this information this morning and got it updated. So I looked at just jobs around here for medical assistants in the Denver area. So, there's probably a lot more out there. And, this is just for Denver as of this morning. But here's some kind of clinic openings where they're hiring medical assistants. So your family practice clinics are always needing medical assistants. There's surgical specialists that are looking for medical assistants, cardiologists, OBGYN clinics, internal medicine, urology, dermatology, neurology, pediatric, hematology, oncology clinic. So there, are a lot of different areas that you can go into and get experience, in dermatology or cardiology, and then kind of, maybe you find out you really like this area of the healthcare field, and then kind of continue your journey there, whether it's, becoming a nurse or, going on to be your own cardiologist. So you can really get experience working with all kinds of patients and different areas. People have, going to the clinic for a lot of different things. And then two kind of, unique ones I found were a remote position for a medical assistant. The title was remote enrollment specialist. So that's an option where you're just kind of working from home and you're taking patient calls and getting them kind of checked in. And then I also saw a medical administrative assistant in a radiology outpatient office. I do talk to a lot of people and they have an interest in like x-rays and stuff like that, sonograms, sonographers, stuff like that. So just letting you know there's a lot of different avenues, for medical assistants to kind of veer off into. So when looking at these roles, I looked at the dermatology clinic and they're hiring a medical assistant. And this was just in their job description. So this is just kind of what a medical assistant can expect to do in a dermatologist office. So their essential functions, they're rooming patients and documents all vital information. So they're taking that patient back, they're asking the patient those questions, taking the notes, scribing the information for the dermatologist, providing post-op wound care. So, if someone's coming back into the office after having a procedure, they're helping with that, drawing blood, removing sutures, cleaning and stocking exam rooms, and scheduling patient appointments. They're also helping providers with, minor procedures like giving injections, doing biopsies, surgical photographs. Some of these things I don't even know what they are, but they're helping the providers. So look at all of these skills that a medical assistant is getting to experience. Again, and this is just in a dermatologist clinic. So, there's lots of other procedures that they could be assisting with depending on where they are. And just some other unique pathways that I'll talk about for medical assistants. Some medical assistants, move into a role as a referral specialist. Then they kind of move into possibly a care coordinator, and then maybe they go the social worker route. So that's just one kind of avenue that someone can take. For starting off as a medical assistant, they can move up into a medical assistant lead, okay, like a kind of then a clinic manager, and then maybe an operations manager for some bigger healthcare organization. And some of these roles are definitely, you're going to need more schooling and things like that, but these are just some open possibilities. And then maybe you become a medical assistant and you really like the admin stuff. You really like the billing and medical coding, working with insurance, kind of figuring that puzzle out. You can move into becoming a billing specialist, a finance specialist, and then maybe eventually a finance director. Yeah, so just kind of wanting to present that there's a lot of options and a lot of different ways that you can take this, this career. Okay, so now I've kind of talked about the role enough, where you can go, things like that, what you do on a daily basis. Now I'll talk about our program. So I'll just kind of do a quick overview of the program, nothing super detailed. But our program requires no previous experience in the healthcare field. So we don't look at any classes that you've taken in the past. We don't look at any tests you've passed, any GPA, grades, like anything like that. It's completely entry level. We do prepare our students to enter the field as entry level medical assistants. We just want you to have a strong interest in healthcare, so you're motivated to start and finish our program, and you're really going to get the most out of this. And then at the end of our program, we do prepare our graduates to sit for one of the 3 credentialing exams that exist out there. So someone can take the CMA, the CCMA, or the RMA. So Certified Medical Assistant, that's what CMA stands for. CCMA stands for Certified Clinical Medical Assistant, and then RMA stands for Registered Medical Assistant. All 3 are very similar, and you'll work with an instructor to kind of pick which avenue is best for you, which test to take, depending on, what area of the country you're in, things like that. But our curriculum does prepare you to take and pass each one, or one of these exams, one of these 3. I see the chat. Yes, high school diploma is a program requirement, high school diploma or GED. I think I have a slide later on too to kind of talk about like a timeline for a specific student. So our program is a little bit unique in the fact that all of our coursework for the NIMAA program is done online. So students are, doing online lessons, they're watching videos, they're doing discussion boards, assignments, virtual simulations. Like, for example, there's a virtual simulation on drawing blood. So you're kind of just moving. It's like playing a little video game. You're like moving your needle and stuff like that, getting your patient prepped to draw blood. And then there are 2 Zoom meetings that happen a week with our students. There's touch points with their instructors. And then they also, the unique part is while they're doing their online learning throughout the week, they're also going in person to a clinic. They're going into that clinic for about 10 to 15 hours a week. So that is where they're kind of really getting that hands-on experience. It's not just you alone on a computer all day learning how to do this. You might be doing your virtual simulation on drawing blood, and then the next week you're shadowing someone in the clinic who's drawing blood. Okay, you're not immediately drawing patients' blood, but you're shadowing and you're observing and learning and getting that hands-on experience and kind of that hands-on job training. And that happens, so that's happening simultaneously throughout the entire course of the program. So every student, doing some online work and going into the clinic every week. Our program is split into 4 different blocks. It's 8 months long, or 29 weeks specifically. Our program has 2 cohorts every year. We always have students starting in the fall. So they'll start in September and they'll be done by the next April. And then we also have students starting every spring. So they'll start their classes in March and be done by that October. So it's split into 4 blocks. Schools usually kind of split into 2 semesters. You have a fall and a spring semester, really. You kind of get that big break in the middle. We kind of split it up into 4 different sections instead of 2. So each of the 4 blocks that the students take are then broken up like this. So they're broken up into 3 sections. So week 1 through 6 of a block is where you're learning your new skills. You might be learning medical terminology and phlebotomy in week 1 through 6. You're doing all your online lessons, you're doing your Zoom meetings with your instructors. You're really just doing a bulk of the learning for that block. And then in week 7, everything you learned from week 1 through 6 is being applied to a group case study. So we call this week Applied Medical Assisting Week. So you're taking everything that you learned from week 1 through 6 and you're applying it to an actual patient with your group members. So you're kind of working on that stuff. You're not going into the clinic during this time. You're really just focusing on that group project and kind of treating your patient. And then there's a pause week. At the end of each block, students are given a pause week as like a complete break. So there's kind of four breaks split throughout the course. So no Zoom meetings, no going into the clinic, no assignments, assuming you're done with everything. And so then again, this whole 3-part process happens 4 different times. Okay, and this is just a sample of a student's schedule. This can look different for every person. Every person is a different type of learner. some people need a little bit longer, or maybe there's just 1 week that you're really struggling with your medical terminology. So you might be spending a little bit more time on your online work. But for the most part, students spend about 15 to 20 hours doing their online coursework. So you see this student, they're doing some Monday, Tuesday, Wednesday, 3 hours on Thursday. They're kind of splitting it up into all 7 days. You can decide what works best for you. Okay. And then they're spending about 10 to 12 hours in the clinic shadowing another medical assistant. Okay, they're working with patients, they're working alongside medical assistants, alongside nurses, doctors. So they're in the clinic during those blue time blocks that you see. And as well as the purple. A purple is the skills lab. So students do have skills labs every other week. They go from about 2 to 4 hours. Now, skills lab is kind of like a setting where you're in a room with all of your classmates and the people working at the clinic that are part of the NIMAA program. And for example, first skills lab is hand washing. So the very, low risk one, but very important. So you're learning how to properly wash hands. Other skills labs are taking vitals. So you're practicing taking blood pressure from, it might be like a anatomical model, or it might be you're practicing on your classmates. Okay, so it's just a dedicated time for you to practice those hands-on skills in a safe environment. You're not being asked to perform anything that you're not comfortable with on real patients. Okay, you're just in a skills lab setting. And then the orange is a Zoom meeting that you see with the instructor. So yeah, the online work is flexible. That can be determined, whatever fits your schedule, as well as the in-person, the blue part. That can kind of change around too. You need to get at least 10 hours done a week when the clinic is open and seeing patients, but that can move around for you as well. That can look different for every person. Okay, any questions or anything?
Megan, in your experience for students having 15 to 20 hours a week, basically it's a flexible schedule. They can move around as needed and things like that. Is it ever intense to where maybe they can't get a job, or is there sometimes where they could work and be going to school as well? Sometimes that's needed. Do you guys offer anything like that you're aware of in the NIMAA program for, hey, these are hiring because they're still learning, maybe they do front desk and not everything, or are you aware of anything like that with students?
Yeah. So not with our clinics here in Colorado, not to say it's not a possibility, but other clinics that we partner with in the US, yes, they sometimes even prefer to hire the students on as like a patient representative while they're doing the NIMAA program. But from my experience, most of our students actually do work a part-time job, if not a full-time job, which is a lot, and I don't necessarily recommend it if it's not necessary. But a lot of our students, I would say, working part-time, something like that's pretty flexible that you can work on the weekends, just kind of part-time work. A lot of people do like those flex jobs with Amazon and things like that. So I would say that the NIMAA program is part-time, but it is work to make it part-time. You have to be dedicated if you have a day off to get your work done, right? So that you're not getting behind on things. But for the most part, I would say that a lot of our students, do have a part-time job. And we do offer student services. We have someone specific on our team who will sit down with you if you're having trouble with time management, and they'll let's look at your work schedule together, and let's look at your NIMAA assignments together. What kind of plan can we come up with? So we have someone on our team that does that, as well as the instructors. They're giving a lot of helpful advice as well. They're virtual instructors, so they're very familiar with kind of working in a virtual environment where it does take, motivation and kind of self-discipline to really kind of schedule your things out. So I would say that our instructors are really great at giving students lots of tips and advice on how maybe they would do it. Does that answer your question?
Yeah, that's great. Thank you so much.
Awesome. Yeah. Yeah, so you're really going into the clinic maybe 2, maybe 3 days a week, just kind of depending on how it's kind of split up. So, those other days you have for getting your online assignments done or working or just other responsibilities, like having a life. Okay, so then next I have another question for you. Which of the following is an example of a medical assistant's responsibility related to medical billing and coding? So is that A, assisting with wound dressings, B, updating patient demographic information, C, filing medical records, or D, verifying health insurance coverage? I'll give you a second to think about your answer. It's a little bit of an easier one, I think. D, so verifying health insurance coverage is something that a medical assistant would need to do for the patient. Yeah, and for the clinic.
Do
Okay,
you guys
yeah, go ahead.
do you guys do, because being on the phone is there's phone skills. So do you guys work on those in class as well? Like this is a phone script, this is how we typically do X, Y, and Z. I mean, I'm assuming yes, but
Yeah, good question. Yes, absolutely. That's kind of like the first set of courses I would say before we get into like the, technical skills and the clinical skills. We're really just kind of working on that patient relationship and communication. And then as well as every time you're in the clinic, you're observing medical assistants. So you're kind of getting to hear them on that side of the phone. Um, so kind of, and there's a lot of, hopefully other medical assistants and other staff too that are taking phone calls that you can really kind of learn from. Like each person does it a little bit differently. So yeah, that's definitely a good question. But yes, there's lots of opportunities to practice with other students too, your classmates as well. Okay, and then I'll just talk about, our program is nationwide. So these are some areas that we have clinics, clinical partners with. And like I said, we do partner with a lot of federally qualified health centers. So we're kind of all over the place, even in Hawaii, which I don't have couldn't get that in the map, but we do have some clinical partners out there as well. So that's also kind of a unique thing about um, our program is, maybe you're living in Colorado and your instructor might actually, we have a lot of instructors in Connecticut. So your instructor might actually live in Connecticut, and you and your class with your instructor on your Zoom meetings might have students from the Chicago area, from Pennsylvania. So you're kind of getting to hear their stories and their experiences of what's happening in their clinics and what's kind of some of their patient interactions. So you are kind of getting a little bit of insight into what it's like across the US. Another thing I'll say. So yeah, your instructor might be in Connecticut, so there's a 2-hour time difference there. I will say that being a virtual program, we also know that a lot of students are doing their assignments after hours. After 5 o'clock, they're doing a lot of their assignments on Saturdays and Sundays, things like that. NIMAA always has an instructor on call. It might not be your exact instructor, but if you have a question on an assignment, because all the instructors and classes are doing the same stuff. So if you have a question on an assignment and it's a Saturday afternoon, there is an instructor on call available to answer your question. And, maybe it's a quick phone call, maybe you're texting that instructor, or maybe you just need to hop on a Zoom really quick with them and kind of get this going so that you can get your work done and turned in on time. So that's an aspect that I think really helps a lot of students, just kind of having that instructor available. So then I'll talk about our Colorado partners. These are partners at this current moment. I can't speak for the future because they kind of choose, and see if they're able to sign on and take on students for the cohorts. But here's the kind of clinics that we work with. So we have Clinica, Valleywide, Salud Family Health Center, San Luis Valley, Tepeyac Community Health Center, and Denver Health and Hospital Authority. So like I said, these are current right now for the spring cohort that we're recruiting for. Hopefully we're adding more. but it does kind of change from different cohorts. So at the time, if you would choose to apply at the time of your application, you'll be able to see the current list, and you'll be able to look at these clinics' locations and decide which one is the best commute for me, which one, I'm close to two of these, and I looked at both of their websites. I really think that I align with Salud Family Health Center's mission and kind of what they're trying to do. So I, on my application, am going to click them as my first preference to do my clinical hours at. So just as like a statewide map, just to kind of see where these clinics are within the state. Here is a kind of map that we see here. Each one kind of represents a different organization. So this like bright red here, I believe that those are Valley-wide clinics. The green is San Luis Valley. Our blue is Salud Family Health Centers. So this is an interactive map that I just screenshot from our website as well. So when you go on our website's homepage, this is clickable and things like you'll see the actual address, you'll see the name of the clinic and things like that. If we kind of zoom into the Denver area, we see this. There's a lot of clinics here. A lot of Denver health clinics. Salud's kind of over here, right downtown's Tepeyac, and then Clinica up here. So quite a good number of options. Okay, program requirements. So like I mentioned earlier, there's no prerequisites or prior experience that you need to have to join the NIMAA program. You do need to have your high school diploma, GED, or equivalent. Equivalent just kind of means if someone completed their education outside of the United States, they would just need to have it rated for equivalency to see if it's equal to a high school diploma here in the US. But that would not be keeping them from entering the program as long as it's equivalent. You need to be 18 by the time the program completes, meaning you can start at 17, and if the program is ending in October or April, just as long as you're turning 18 before your program's end date, you can be part of the program. At this time, the program is only offered in English, and it is an online environment, so that kind of takes some skills as well on your own. There's not really someone there to like help translate for you or things like that. So proficiency in verbal and written English, just so that you don't feel overwhelmed and that you're successful in the program. NIMAA does do a background check, and then just reliable access to computer, internet is an online program. If you need resources, we are also here to help provide that. Like I said, our student services specialist, she has like an entire like running list of places that offer affordable computers that you might be able to get a hotspot from. Oftentimes we'll kind of have partnerships and grants with like T-Mobile, for example, and they'll have hotspots that we can send to students that might need those. And then reliable transportation, whatever that might look like for you. If that's getting a ride with someone that you live with, they're able to commit to getting you to the clinic in person, so you can do your hours. If you're taking public transportation, or if you really are a pro user at Uber and Lyft, or you have your own vehicle. So that can mean kind of different things for people, but just reliable that you're able to get to the clinic and do your clinical hours, since that's a big part of the program. Any questions on any of the requirements or anything?
I don't see any yet.
Okay. All right, I think this is my last question, my last test question. So choose the correct process for obtaining prior authorization from an insurance company for a patient's medical procedure. Okay, so would that be A, fax the procedure request to the insurance company and wait for approval? B, have the physician call the insurance company directly to request authorization? C, complete the necessary paperwork and submit it to the insurance company and then follow up as needed? Or D, tell the patient to pay for the procedure out of pocket since insurance authorization is not your role? Yeah, see. So the medical assistant is going to complete the necessary paperwork and submit it to the insurance company and then follow up as needed. Oh no, I've had to happen to you. Um, yeah, this is not something I would have known though as a high school student. My mom's handling all that or someone else is handling all that. So this is,
Yeah.
I would have to do some critical thinking. Okay. And so just talk about the NIMAA admissions process. So what does that look like, if you were interested in applying? So first step would be to submit an online application. So we have a written application and there's some short answer questions and things like that for you to answer. You can always come back to the application. It saves your progress, so you don't have to sit there and really reel over the answers. Um, and then next is a follow-up phone interview with someone from NIMAA. So you'll schedule this phone call, and then someone from NIMAA will give you a call at that day and time that you scheduled. They'll just be looking over your application. If they have any follow-up questions, they kind of need more information from you. They'll ask you, what do you know about the role of a medical assistant? Have you done research? Do you know what you're getting into? Why are you interested in becoming a medical assistant? And, it's totally fine to be honest. Like, I want to get my foot into the door in healthcare. I want to get that patient experience and I want to continue on to go to nursing school. So just, be honest. This is a great pathway. That's what it's here for. And then if you move on from that phone interview with the NIMAA representative, you have a chance to interview with that externship clinic that you so I used Salud Family Health as an example earlier. The NIMAA person will confirm that you want to still move forward with Salud, and then we'll send your information over to Salud. Salud would reach out to you and they'd ask you a little bit more questions than kind of what was in the NIMAA interview. But again, they're just wanting to make sure that you know what you're getting into, you have an actual interest in this, you're comfortable working with, bodily fluids and just patients in general. They don't, want you to get in over your head and things like that. So they'll just have a little bit more follow-up questions for you. And then we use all three of those things, your responses from the application, the feedback from the NIMAA phone interview, and the feedback that the clinic provides NIMAA to make our decisions. Okay, so kind of like a 3-step process there. And then just kind of when to apply. So like I said, you to start in the program, to be enrolled in the program, you do need to have your high school diploma, meaning current seniors that are going to be graduating, whatever between May and August, a lot of May and June probably. But if you are a senior and you're getting your diploma then you can actually apply for our our fall cohort, which the application opens in March. So you would apply in March if you're a senior right now. And you would begin classes with NIMAA if you're offered admissions in September. So you would be applying before you have your diploma. But if you're planning to get it before September, then you are definitely eligible to apply. So you'd start classes in September and you would be done by April. So 8 months goes quick.
It really does.
Yeah. Okay, and then just some steps about what you can be doing now. If you are a senior and you might be thinking about what's next, maybe I'll consider applying to NIMAA in March, and then just some kind of steps that you can be doing that I kind of recommend as well. So I would explore our website. That's just nimaa.edu. We have a program catalog on there. You can look through the list of courses that you'll be, possibly taking. You can start, doing some studying there, some anatomy and physiology. There's some great apps for stuff like that. And then medical terminology as well. You can get a head start on that. Even if you're, not interested in medical assisting route, maybe, but that's just healthcare classes in general. So it's definitely stuff you'll need to know. And then, research medical assisting and the different career pathways. NIMAA does not, yeah, have any programs that students could explore in the career field before graduation.
Amanda, do you mean like hands-on in that? Like shadowing them or?
Sorry, had to find my mic.
Mhm.
Yes. So we do a CDIP program to help with high school retention and also get kids into what field they're interested in before they even graduate and like learning about it so that they have a better concept of if that's what they actually want to do.
Mhm.
And so like that's part of why we're doing this focus on your awesome shadowing stuff that we're talking about now. And so I'm wondering if there are more opportunities we could work with NIMAA with in the future.
Yeah. So yeah, NIMA doesn't have that. It's mainly student-based working or school-wise, but we do have access to shadowing, for an example, like Ames Community College. For if you were interested in the medical field, we can talk more about that in the future, for hands-on for the students to be able to shadow that.
Perfect. Yeah, Kim is actually taking kids to and I can never say it. I'm sorry.
And
Um,
shoots and
yes, thank you,
shoots.
Kim.
Oh, yeah,
Yeah,
that's Audrey. Yeah, Audrey's world is over there too. So that's,
exactly. And so I was trying to think of if we could find even more opportunities. So thank you.
yeah, absolutely. Megan, that brings me that's a great segue, Amanda, for thank you for that. So if students were interested and wanted to know more, is there counselor or something that they can check in with just to like have hash out any questions that they, well, hash is probably not the right word, but just any questions that come to the top of their mind, or I'm not sure, but what about X, Y, and Z? Some of them have to work. They can't skim on that. So just I like how you said earlier, for your students, there's somebody that can look at time management and look at the things like that. But is there somebody that can do that before they get into the program? Like, hey, I'm just interested. I'm not sure yet. I really am interested in MA, but because what's great about this program is it's transferable. So you can go, like you said, a bunch of different places, gain more experience that are transferable to um other fields. So I really like how NIMAA work. I love NIMAA, how NIMAA's program works. So just wanted to know about that
Yeah,
because
yeah, great question. So that would be me. So I would kind of be the admissions counselor. We can set up a phone call, we can text back and forth, whatever you prefer. We can hop on a Zoom for an admissions counseling meeting. But yeah, that would be me, and I'd kind of help answer all of those questions and kind of a lot of those questions really do get answered in the when the applicants talk with the clinic and that externship interview. So, they're kind of already in the process, but they're not like committed to anything. They're again just in the process. They're not under like
they
any
can
type.
pull out basically in that
Yeah.
area. Because
Yeah.
sometimes people, I've had students that are like, I don't want to do it because I don't want to pull out at the middle, the end, and everything's already done. So it's good to know that they can do that.
Yeah, that happens all the time. Circumstances come up for people, and maybe they had a family thing come up and they realize they can't be available for the next 8 months. Or their, family's considering moving or things like that. Yes, that happens, quite often, unfortunately, but we hate to see them go. But a lot of people find their way back as well. So, we totally understand. But yeah, I can definitely talk with them before. So I also do host like regular info sessions as well. If you follow us on social media or you look on our website, I have about 10, Zoom meetings in the evenings for students, prospective applicants to join me, where I kind of, do this whole thing, but then answer like specific questions. But yeah, that's a good one. That would be me. So yeah, some other things I kind of recommend doing is just your research on medical assisting and different career pathways. Like I did this morning, I spent 10 minutes looking at open jobs, but that's something that you can spend more time doing in your area if you're not necessarily in Denver. And then I would, recommend identifying what aspects of a program are important to you if you're considering other programs, if you're considering a four-year college or, community college for your associates, like I would kind of make a list of things that, are really important. Is that cost, the location, the length of the program, what kind of career options are available. So that would be my advice. And then, kind of compare and contrast once you have that list, compare and contrast those aspects of different programs. So you're making the best decision for you. Don't be afraid to reach out to these programs. They all have someone like me in a position that is there to answer those questions for you and help you. Like I said, follow us on social media and you'll see all of our Zoom info sessions that we're hosting. Go to as many of those as you want. Reach out to me. My best email is just info@nimaa.edu. But from our website, there's like one of those little bouncing, like ask me question little features, and those go directly to me. So type anything you want in that little bubble and it goes to me and we can connect that way. And yeah, just looking at any like salary-based questions or just like those job opening statistics that I had in the beginning, kind of exploring the Bureau of Labor and Statistics website just to get that accurate information. Yeah, that's all from me. Thank you guys so much.